Hi, this is Brian Kim, and I'd like to share with you a recent case I did of a white cataract doing double chop and cross chop. My double chop and cross chop technique are a modified Phaco chop technique that I came up with to be an efficient and safer way of doing Phaco chop. So I placed the chopper out to the equator in typical horizontal chopping fashion, but the difference now is I will place the Phaco tip sub-incisionally almost in the same fashion as a mirror image instrument. And I bring both instruments together along the equatorial plane, fracture the lens mechanically, purely through irrigation only and without Phaco or aspiration or vacuum. And then I separate the two pieces, and I take the chopper all the way across to the other side, and I do the same maneuver, again, without any Phaco energy or aspiration, and I fracture the right heminucleus. And I believe this is safer because it requires no Phaco energy or aspiration during these maneuvers. After staining the anterior capsule with trypan blue, I puncture the lens with my forceps. As you can see, there was no cortical milk coming up, so this is not an intumescent white cataract. For the intumescent white cataracts, usually the most challenging part is the capsulorhexis. Those lenses tend to be extremely soft and fluffy, and so lens removal for those cases is really quite routine. I don't have any difficulty making my capsulorhexis here, and so at this point I don't feel like this is going to be really a challenging cataract removal, but I'll soon find out. Hydrodissection for these cases is also a formality. Most of these lenses do not have much cortex. Mostly this is just posterior capsule as well as a fluffy epinucleus, and so the lens is pretty much disassociated from the capsule. So I'm going to place the chopper out to the equator in horizontal chopping fashion. In the moment, I'm going to take my Phaco tip and do the same thing sub-incisionally, bring the instruments together along the same plane, and fracture the lens. I'm going to leave my Phaco tip in the middle without moving, take the chopper out to the equator, and perform the cross-chop maneuver. If you paid attention, all of those maneuvers were purely under irrigation position 0 only. I did not use any Phaco energy or aspiration or vacuum. And if you pay attention, every time I fracture the lens, it is always under position 0 with irrigation only. So here I'm on position 0. I put my chopper and Phaco hand pieces and I sandwich them to fracture the lens. And that's the main movement. I am sandwiching the pieces between my two instruments. Again, here, position 0 under irrigation only, sandwich the piece, and it fractures this left heminucleus. I only initiate Phaco with aspiration and vacuum when I'm ready to emulsify the pieces. And I'm always initiating Phaco and vacuum and aspiration while the Phaco tip is in the central safe zone. I try not to fish with the Phaco tip out to the periphery and risk snagging the iris or the capsule. Again, this is the last quadrant, and all I'm going to do now is go to position 0 after I remove this small little fragment. I'm going to place the chopper out to around the piece, sandwich the lens material with my instruments, and then ready to emulsify the lens. And even with this last piece, it gets a little bit of a challenge. You always want to protect the bag with the chopper, but even there you saw I went to position 0 when I sandwiched the lens between my instruments. As I said before, you expect there to be very little cortex with these cases, and indeed there was not very much. There were just some fine wispy cortical fibers here, and I'm doing the best I can to sweep around and remove any tags underneath the anterior capsule as well as on the posterior capsule. Again, to review my technique, I feel it's a safer, more efficient way because I'm not chasing pieces, I'm not using Phaco or vacuum, which can cause uncontrolled situations while you're in the eye. I sense that might be some stubborn subincisional cortex, And so I fill the bag with cohesive OVD, and I use my sweep to sweep into the capsular fornix subincisionally, and lo and behold, there's a small cortical wisp area there. And I'm still teasing and teasing. And as I do so, I see one more piece there. I see some more on the 3 o'clock position, and there's another piece of cortical wisp along that 3 o'clock position. So the sweep is not only good for polishing underneath the anterior capsule, but it's also great for trying to sweep and liberate subincisional cortex, or any cortex that's difficult to reach. I'm using a single piece acrylic lens. When I evacuate the viscoelastic, I like to make sure that the haptics are in the bag, and then I like to tilt the lens sideways a little bit to ensure that I can go underneath it and remove any viscoelastic in the bag. After cleaning everything up, I like to keep the anterior chamber stable by irrigating with BSS when I take the INA hand tip out, just to keep the chamber stable. I'll hydrate my incisions in typical fashion, and I hydrate the roof, which will self-seal. And I'm hydrating the roof here as well of the paracentesis site. I hope this was educational to you. Again, I believe double chop and cross chop are versatile techniques, even for white cataracts. Thank you again for your attention and taking the time to watch this video.